Hello everybody, I wanted to record this short video for those of you who requested information on how to order the over-the-counter products. This is a benefit that you have. Every quarter you have an allowance and it will depend on the plan and the carrier that you have of how much this allowance is going to be for. Make sure that you check on your catalog that you should have received when you first sign up with your insurance. You should have received your members card and this catalog. This, you're supposed to keep it for the entire year so that you can order these products every quarter. So depending on what plan and what insurance, go back into your catalog book and check what is your allowance amount and whether this amount can roll over into the next month. If not, you will lose that benefit for that quarter. Like I mentioned, every company is different, and I'm going to go over the details on how to make the order in general for each of the companies. This catalog here is for United Healthcare. United Healthcare has a different process where you should have also received, in addition to the catalog, this blue card. This blue card is going to have this long number here that they're going to ask you once you call to make this order, and a security code. If you do not have the catalog or this blue card, you can still make the order through the customer service line that's in the back of your card, and they will let you know what number to contact, and they will give you this information. At the same time, let them know that you misplaced this card so that they can send you a new one. You can make these orders three ways. You can make it online, you can make it over the phone, or by mail. I'm going to go over the details on how to make this order over the phone because it's the easiest way to do it. This catalog is for scan. For those of you who have scanned, this is how the catalog looks. If you have misplaced it, if you don't have it, then I would recommend that you call the customer service in the back of your card, or even the OTC line, health products it might also say, or over-the-counter products. Just call that number, let them know that you need a new catalog to be mailed to your address. This is the catalog for Blue Shield of California. And this is a list that I made a sample on how to keep track of the products that you will be ordering so that you have the information that the representative will ask once you have them on the phone. So let's go over how to make this order. Within the catalog, you're going to have the 1-800 number, or the number that you call to make this order. But before you call them, make sure that you go over the products that you are interested in ordering, and you make a note on the list that I show you. This is the example. You go back and you make a note of all the item numbers that are here to the left for the products that you're interested in ordering. So for example, if you want to order this Benadryl allergy liquid gels, you're gonna write down this number, item 1927, the name of the product, and the price that's here on this list for each one of the products. Once you have your list ready, you can call that number. They're gonna ask you for your personal information to make sure that you are the member and that you are who you say you are. And once they're ready, they're gonna start asking you for the item numbers for each of the products that you want to order. This is the catalog, like I said, for scan. This is how the catalog looks for those of you who are with WellCare. And for WellCare, it's the same exact process. They have a number that you call, and they will ask you for the item number of the products that you want to order. This is the catalog for Blue Shield of California. This is the catalog for Anthem. But the process is very similar for all of them. All you have to do is go to your catalog, make sure that you write down the item number for each of the products that you're interested in ordering. For United Healthcare is down here. You write down the item number, the name, and the price. Make sure that you know the amount so that you have enough products to amount to that allowance. If you go over, the representative will definitely let you know. If you are missing $1 or two, they will also give you options on what else you might be able to order without going over. If you do go over, you will have to pay the difference. So make sure that you know the exact amount. If you don't know the amount, you can always ask the representative to let you know what the amount is that you are allowed every quarter. Let's see, this is for scan. This one is for WellCare. I just want to show you how the list looks for each one of the catalogs so that you are more familiar. This is the item number for the items with WellCare. Here it is under SKU. Okay, let's see for the next one, which is Blue Shield. The item number is under SKU as well. And let's see for Anthem Blue Cross Blue Shield. The item number, this is a little bit different because they give you the summary of all the products and its categories, and at the end they give you the list. For Anthem, the item number is labeled as item number, so you will be able to find it here on the name and the price. So in summary, make sure you do have your catalog. If not, in the back of your member's card, you should have a number for customer service or for over-the-counter products. It might say OTC number, health products, over-the-counter products number. You contact either one of those two numbers and they will guide you to the correct line where you need to make this order. Make sure you have a list of your products in front of you so that you know which you're gonna order, and you make the phone call. It shouldn't be that difficult. It's actually very easy once you have everything in front of you. For United Healthcare, make sure that you have the blue card as well. If not, you let them know that you have misplaced it and for them to send you a new one. I hope that this information helps, but if you still have any issues, give me a call and I will see how I can help you. Thank you. Bye-bye.